Western Mass News is your vaccine authority, and we're getting you answers to questions you may have about the COVID-19 vaccine. Welcome, everyone. Thanks for joining us. I'm Jordan Jagalinzer. This is a topic that has dominated headlines now for several months. People questioning how safe the vaccines are. Will they be impacted by potential variants of the coronavirus, and so much more. So we are on for the next 30 minutes right here on Facebook Live, as well as our streaming platforms. You can chime into the conversation by commenting on our Facebook feed. So right down below with any questions that you have as we get answers from a local expert. We're joined live now by Dr. Robert Roos, Chief Medical Officer of Mercy Medical Center in Springfield, which is part of Trinity Health of New England. Dr. Roos, welcome. Thank you so much for joining us.
Well, thank you for having me.
We're looking forward to getting down to all of our viewers' questions. And a big talker tonight is about the Johnson & Johnson vaccine. It's near FDA approval. What do we know at this time about the Johnson & Johnson vaccine?
Well, today there was some very promising news released. Some of the data from the trials that the FDA is going to be looking at and voting on in just 2 days showed that this vaccine is incredibly effective, both to prevent COVID, but even more so to prevent serious complications in cases of COVID. And so this would represent, if authorized with a vote that could come as early as Saturday, a third vaccine that is shown to be safe and effective in protecting people against COVID. What we know about the Johnson & Johnson vaccine is that this is a vaccine that, if it's available in the United States, would be a vaccine that allowed people to be protected with just a single dose. And it's able to do that by the technology that's utilized, allows it to also be stored a bit more stably, not requiring the ultra cold refrigeration that some of the other vaccines require. So it really could be an opportunity to get vaccines out into some different communities and increase the numbers of people that are vaccinated here in the United States, which is ultimately the goal as we emerge from this pandemic.
And I want to ask you a question that just came in from one of our viewers who says that they live with an 11-year-old. And as you mentioned, Johnson & Johnson is just one dose of the shot. But some people are worried that right now with Moderna and Pfizer's vaccine, if you get the first shot, are you immune from somebody that might be in your household or family or friends, or do you really need to wait and stay away from them until you get that second dose?
So there's a couple of great questions in that comment. First, we know that the vaccines that are currently available, both the Pfizer and the Moderna, do confer some protection even after the first dose. It takes a couple of weeks, 2 to 4 weeks after the first dose, you will start to see significant protection against getting COVID as well as serious disease. But the trials were based primarily on people that got 2 doses at the intervals of 3 or 4 weeks after that first dose. And that's where we saw the efficacy rates exceed 90% and really almost approach 100% in terms of eliminating the risk for hospitalization or death. So we certainly recommend right now that people follow the CDC recommendations in the authorizations from the FDA. And if you're receiving Pfizer or Moderna, you should still receive both doses. For Johnson & Johnson, they have studied both a 1 and a 2 dose regimen, and it is possible, depending on what the FDA authorizes in the near future, that a single dose could be an acceptable option for that vaccine. In regards to that question specifically to the viewer at home, if you have an 11-year-old, we recommend specifically that you would keep yourself protected by wearing masks and practicing hand hygiene and so forth. There are no vaccines right now that are currently authorized for individuals under the age of 16. There are some studies that are ongoing, but right now we don't have a vaccine for that 11-year-old. And so we'll have to ensure that they protect themselves, and we take steps to protect ourselves so we don't give kids coronavirus either.
Absolutely, Dr. Roos. Thank you so much. And another big difference between Johnson & Johnson and Moderna and Pfizer is that Johnson & Johnson is a DNA vaccine versus an mRNA vaccine. Can you tell us what the difference is between the two for those at home who don't really know the difference?
Sure. I'll start with the mRNA vaccine. When we talk about these types of vaccines, it's really referring to the technology at sort of the chemical level that helps the body know to initiate an immune response. So an mRNA vaccine merely stands for messenger ribonucleic acid, right, which is a chemical that's found in our bodies. In this case, both the Pfizer and the Moderna vaccines use this technology by administering a piece of mRNA that is like an instruction manual so that your body knows that it should make a particular protein called a spike protein that is one of the proteins on the rim of the coronavirus. When your body makes that protein, which is inactive and can't cause any illness, it knows to stimulate the production of very specific antibodies to that protein to fight off the coronavirus if you were ever exposed, as well as create immune cell memory to fight it off in the event that the virus, you were exposed to the virus. A DNA virus actually is a more kind of traditional virus. We've used these types of viruses for quite some time. It takes an inactive piece of the genetic material, the DNA, if you will, and attaches it to a killed different type of a virus, an adenovirus in this case with Johnson & Johnson. So when the vaccine is administered into your body, it essentially does the same thing. It gets into the cells, stimulates your body to create that spike protein, and thereby, after that, the antibodies and the immune protection. So when we differentiate mRNA and DNA, there's, when you get down to it, there's not a lot of difference. It's stimulating the same sort of response in your body, but it's just using a different form of technology to do so.
Now, is the flu shot then a DNA vaccine?
Yeah, it often is, where it takes a double-stranded DNA and it combines it into an inactive form of another virus, and then it stimulates the production there. So there are many types of vaccines that have utilized that technology. The mRNA technology is not new. It's been in development for over a decade, but this is the first types of vaccines that we've utilized and been authorized to use them in this type of situation. And so they're not new in one respect because they've been under development for a long time, but it's the first time that we're seeing them widely available to treat a virus now. And we're finding that they're incredibly ingenious, safe, and effective. And I imagine mRNA viruses are the future of many types of vaccines to come.
So for our viewers at home who are going to be maybe, in the later months getting the Johnson & Johnson vaccine, there's kind of been some speculation on social media that the vaccine could alter your DNA or give me cancer. Is any of that true?
No, unequivocally, no. Those are some myths. There's really no evidence at all to support any of that type of conversation. When we think about the mRNA or the DNA virus that's within another sort of killed inactive virus, they don't even enter the nucleus of the cells. They are not incorporating themselves into your genetic material in any way, and there's no evidence to suggest that it would lead to something like cancer. These are really instruction manuals to help your body know to create a protein. It's really, really an innovative, and it's proven to be extremely safe. We've now administered mRNA vaccines all across the world. We've administered over 64 or 65 million right here in the United States over the last few months. And it's incredible, the effectiveness that we're seeing from these vaccines. And again, I think it's remarkable with what we've seen in terms of its safety profile so far.
And I want to ask a question, too, that came in from one of our viewers asking, I will be traveling. If I get the vaccine before I go, do I need to be tested when I come back? And I think a lot of people who are now getting the vaccines are breathing a sigh of relief. But do you think that would be okay for our viewer?
So it really depends on your individual situation. Right now, what we do know, and I do think it's okay to start to breathe a bit of a sigh of relief in that, knowing that for yourself, if you've received both doses of one of the authorized vaccines and a couple of weeks after that second dose has passed, you can feel very comfortable that you are protected against a serious form of COVID if you were exposed. What we don't know at this point is if these vaccines completely eliminate the possibility that you could get the virus and give it to somebody else, or if you could get infected at some point with one of the newer variants of concern. So it really depends on where you're traveling, what types of interactions that you're having, and who is in your life when you return home from where you're traveling. So I would encourage people to continue to follow the CDC recommendations regarding travel. as well as the recommendations from here, the Commonwealth of Massachusetts travel advisories, and to continue to follow the public health practices of masking, practicing hand hygiene, physical distancing, and avoiding large gatherings for many reasons, for yourself, but also because not everybody in our community, in fact, is vaccinated. In fact, just a small percentage of our community is vaccinated and immune at this point. And we certainly don't want to contribute to illness in other people. So I would encourage the viewer to still be cautious, to still be mindful, while recognizing that you yourself do have a higher level of protection after you've been vaccinated. We will get to a point when all those other rules change, but we're not just quite there yet.
And I want to step back a couple points to the variants that you had mentioned. There are obviously some different virus variants that are across the globe right now. What exactly is a variant, and should we be concerned? And are you vaccinated if right now, if you then come across one of those variants?
So, variants are on a lot of people's minds, and I think appropriately so. A variant just means that it's a slightly different strain of the coronavirus. And this is not something that is unexpected. This is something, as viruses change over time, that we would expect to occur. We know that we see different flu viruses every year. We see different adeno and coronaviruses every year. What right now we need to be mindful of is that there are a few variants of concern, particularly the one that has been found in the United Kingdom to be the predominant strain, the one in South Africa similarly, and now there's been a lot of news and reporting of a strain that's really been homegrown and appears to be spreading pretty rapidly in California. The concerns with these variants, or perhaps other variants in the future, is that if they are significantly more infectious, meaning that they can transmit to people at a higher rate than the coronavirus that we had been dealing with for the greater part of this year, or if they would lead to more severe infections, or if they were less susceptible to the protective effects of the vaccine, well, that could lead to virus spreading all throughout the country in a way that, unfortunately would cause more tragedy. At this point, while they're called variants of concern, I would stress to people that we need to be mindful, that there's a lot more science that needs to establish itself regarding the real risk of these variants here in Massachusetts and across the country, and to continue to just follow and heed the same advice that we've been speaking about for the last year. Because at its core, whatever variant there is, it's a virus that is spread by respiratory droplets, and we will prevent its spread if we follow the practices of masking and distancing and avoiding large gatherings. And many of the vaccines are showing that they are and do have some significant efficacy against many of the variants. It may or may not be at this same level, 95% or greater, but it likely will provide some level of protection or immunity to you as well. So we still encourage the same recommendations that we would, and we should be cautious as we continue to monitor this going forward.
And I want to get to a great question from another one of our viewers, Margarita, who says, if I'm allergic to penicillin, can I get the vaccine?
Margarita, thank you for the question. You can get the vaccine. And I know there has been a lot of talk and questions about allergies in general. The one reason why somebody can't get one of the currently available vaccines, and the only reason, is if they are allergic to the ingredients in the vaccine itself. But those ingredients are extremely uncommonly found in other things. There is no egg, for example, in these vaccines. There is no latex that's in these vaccines. There are really no artificial additives or anything like that. The vaccine itself is really just the mRNA, some fat molecules that surround it so that it can get into your body, and then another agents that can help it sort of bind. And so you should review the package insert and the ingredients in the vaccine, and just to make sure that you don't have a severe allergy to those. But there is no reason why people with allergies to other things like penicillin, like nuts, like eggs, like dander or pollen, there's no reason why any of those allergies should prevent somebody from getting one of these COVID vaccines. And I would encourage you to do so. If you or anyone has any other questions about that, you could always speak to your allergist or immunologist if you have a particular concern. But in our experience, and what the evidence would show, is that it is still safe to go ahead with the vaccine. You may just need a period of monitoring after the vaccine that's a little bit longer than other people with no history of severe allergies. In our case, and in the CDC's recommendations, it means that people with a history of a severe allergy that includes anaphylaxis or a tightening of the throat should be monitored for at least 30 minutes. That's what we do at Mercy Medical Center, and that's the standard, throughout the healthcare community when monitoring people that have that sort of allergy.
Thank you, Dr. Roos, for that. And Margarita, hopefully at home, that answered your question. And to those of you who are just tuning in on our Facebook Live and on our streaming platforms, we are being joined here by Dr. Robert Roos with Mercy Medical Center and Trinity Health to answer your questions surrounding the COVID-19 vaccine. So please comment below our Facebook post. You can head to our Facebook page if you're watching on a streaming platform, Western Mass News, and we'll try to get to as many questions as we can tonight. So I want to move on, Dr. Roos. A lot of our viewers keep hearing the phrase herd immunity. What exactly does that mean, and what does it have to do with the vaccine?
So herd immunity really means that when there's a certain percentage or a certain number of people that are immune to an infectious disease that are currently in the community itself, whereby then it creates a form of indirect protection for everyone. Because the virus doesn't have anywhere else or anyone else that it can infect in order to continue to spread. Herd immunity is really what we are searching for. It is what we are striving for. It really is the end point when we emerge from this pandemic, because it will signify the fact that the virus is no longer spreading rapidly, and it may even go down to imperceptible levels. The way that a community ends up with herd immunity is only through one of two ways. Through people that have gotten the infection and now have a natural form of immunity in their own antibodies and immune protection, or through effective vaccination, where people are now immune by receiving immunization. We know that with the coronavirus, a certain percentage of the population has gotten infected. It's probably a fairly significant percentage and may have some immunity. But we don't yet know how long that immunity will last and how well that immunity will protect people against reinfection from the same coronavirus or from a variant or strain. So what we do know is that the pathway to herd immunity is through effective vaccination. It is directly linked to how quickly we can vaccinate and how many people in the community, in the state, and across the world are successfully vaccinated. And it really is a global concern because people travel in and out of all sorts of countries. And so we have to approach this from that public health, global health perspective in order to achieve herd immunity and emerge from the pandemic completely.
Well, I'm glad, Dr. Roos, that you mentioned right now in terms of the length of the immunity. We still don't know, because one of our viewers, Carlos, did just ask that. He also asked, do we have to then continue getting a COVID-19 vaccine moving forward? Is it going to be something like the flu shot?
So we don't yet know that, Carlos. It's a great question. It is possible, and then perhaps you might even say it's likely. We know that these viruses continue to mutate and create different strains. And we know that there are ways that we can continue to modify vaccines to be effective against those new strains. So it really depends on how quickly and how successfully we can tamp down and eliminate the spread of the virus now. If we could get the current coronavirus pandemic all the way down to almost zero across the globe through vaccination over the next several months, well, then we may not need boosters because the virus may not continue to circulate as rapidly, and every year we may not see as many infections. Well, but if the infections don't go down that far and the virus continues to circulate, there is a likelihood that people will need boosters so that we continue to protect people from the serious complications.
Sorry about that, Dr. Roos. I didn't mean to cut you off. But speaking of a rapid, this is a popular question a lot of our viewers have been asking our vaccine authority hotline. I'm concerned about the speed at which the vaccine was developed. How do I know that it's safe if it was made and approved so fast?
So I want to say, on one hand, it seems like these vaccines are coming out quickly, but on the other hand, there has been research going on for over a decade for this particular type of vaccine. So I want to reassure folks that for mRNA vaccines in particular, and of course others, they've been in development for a very long time. And so it wasn't like the technology was completely new to scientists that are developing this sort of thing. What we know is that the virus now has been out for about a year. And the way in which we were able to bring these vaccines that are both safe and effective to market this quickly is because we were able to invest large amounts of resources, funding, as well as combine some of the different stages of the clinical trials to be able to be executed in parallel, as opposed for one following another one and another one after that. I can assure everyone that there were no steps in regards to evaluating the safety or the effectiveness in the clinical trials that were skipped or shortened or compromised in any way. The FDA, when it reviews these vaccines, ensures that they are tested in tens of thousands of people across many different populations, and it takes the time over the period of months and months to evaluate that data before it renders a decision on that. We also have to recognize that we make new vaccines very quickly in many cases. We are all very familiar with a brand new flu vaccine coming out by multiple companies every single year. So in many respects, this was very typical. We get a vaccine in about a year. And in some other respects, it was really the culmination of an incredible amount of energy, of innovation, and resources to help bring this out to hundreds of millions of people across the globe. And I think that's really a testament to scientific progress.
I think that's a great point, too, to compare it to the flu vaccine, which, of course, so many of us get yearly. Another popular question, is it safe for pregnant women to get the vaccine? Has it been studied on pregnant women and or babies?
So in the trials for both Pfizer and Moderna, there were not pregnant women included in those trials. However, that being said, there are studies ongoing now with women that are pregnant. And we also know that while pregnant women were not included in the trials specifically, people did get pregnant during the trials as a matter of course. And there has now been a number of different looks at the effectiveness as well as the safety amongst the women that were either pregnant during those trials or after. And there is no evidence at this point to suggest that there is any direct link to harm for the developing baby, for the pregnant woman, or during that postpartum period. And while we know that this is an individual decision for everyone, and if there are questions, that I would encourage women of childbearing age that are pregnant or postpartum to seek guidance from their healthcare provider. The American College of Obstetrics and Gynecology, which is the professional society for OBGYNs here in the United States, recommends vaccination against COVID with the vaccines that we have available. And one of the reasons why it recommends vaccination is because we know for sure that the risk to the pregnant woman and to the developing baby, if the woman gets COVID, is much higher than to somebody who's not pregnant. There are complications during pregnancy, during birth, that can be related to COVID that we still probably don't even fully understand, as this virus does impact the blood supply and the vessels and the blood vessels in our body, even in addition to things like breathing in our lungs in some cases. So there's a lot more study that needs to be done. I would recommend that pregnant women consult with their healthcare providers, but know very solidly that many organizations and professional societies that specialize in this are recommending vaccination for pregnant women and those that are in the postpartum period.
And piggybacking off of that, Dr. Roos, and I know we briefly touched upon children after answering one of our viewers' questions, but is the vaccine safe for children? If not, how do we protect kids against the virus?
So as I mentioned, right now, neither of the authorized vaccines are authorized for any individuals under the age of 16. So the children right now have not been studied in those original clinical trials, but there are clinical trials right now that are ongoing that have enrolled people under the age of 16. And so that is being studied. I would expect that we would find that the similar patterns of safety and efficacy in younger individuals, but it just hasn't been studied or published yet to be able to say that. We do know that kids tend to get COVID in a less severe form than adults or those at the older ages, but we also know that it can happen. We also know that there can be some unusual complications that can occur or things that can last for some time in children after they get the coronavirus. So I would strongly encourage that we continue to protect our kids through the public health measures that we've been recommending, the masking, the distancing, and continuing to practice things like hand hygiene. And as adults, we want to vaccinate ourselves, right? Because the more that we vaccinate ourselves, the less virus will be in the community that could potentially infect individuals at younger ages. So again, the same sort of advice, and we will likely get some more data in the coming months about vaccines that may be available for kids.
And we have a great question that came in from one of our viewers, Idrisu, and we also have another one that's similar from Alexandra Marie asking about, if we'll have any symptoms after the vaccine, and if you do have a reaction, what should you do and who should you consult with?
So Idrisu, that's a great question. And what we do know from this vaccine is that there is a significant percentage of people that may have some mild and self-limited symptoms that can occur after the first or second doses. This is not uncommon. It happens with many different vaccines. By and large, the most common symptom that people would experience after receiving a vaccine is a soreness in the upper arm where the vaccine was received. And that's really just from a needle and some fluid being pushed into the muscle. Sometimes people can develop fevers, chills, muscle aches, a sense of fatigue. And those are really signs that the body is stimulating an immune response, which is not necessarily a bad thing. It oftentimes means that it's reacting to something and it's going to give you protection. People shouldn't worry if they don't get those things, but it is part of some of the expected symptoms that can occur after vaccination. The key to remember is that the first or the second dose, these symptoms really should last about 24 to 48 hours. They generally resolve on their own. And they, if you need to consult a healthcare provider because they're lasting longer or they seem pretty severe, I would recommend that people do that. But by and large, in our experience, we've vaccinated thousands and thousands of people at Mercy Medical Center. There have been millions of vaccinations now across the country. And as you can see, and as we know from our experience, people end up doing very well and not experiencing anything too severe.
And for a lot of people right now in Massachusetts, you may qualify to get the COVID-19 vaccine if you have 2 or more comorbidities. Can you tell us what underlying conditions qualify as comorbidities, Dr. Roos?
Yes, and right now here in Massachusetts, we are in sort of the second segments of phase 2 of the vaccine eligibility, which is following the guidelines from the Centers for Disease Control and Prevention. And just to comment, those guidelines are constructed to help prioritize vaccine to those that are at highest risk of complications from the virus itself, as well as people that are part of the essential infrastructure to keep our society going, like healthcare workers, and soon in a future phase, teachers and transit workers and postal workers, etc. In regards to those with 2 or more chronic conditions that qualify for eligibility, those include conditions like cancer, chronic heart, lung, or kidney disease, including people that have had heart attacks, or people with on dialysis, for example. It also includes those with asthma that's moderate to severe, meaning you take medication every day to try to prevent exacerbations of your asthma. It includes people with type 2 diabetes, obesity with a body mass index of over 30, and smoking. So these are the conditions that would put somebody who would end up acquiring COVID at higher risk. And they're exactly the individuals in our communities that we want to protect the most.
All right, Dr. Roos, and a lot of people are asking about the state and the state's rollout. So here's a question. Why do we have to wait for the state to tell us it's our turn? Does it have to do with supply at all?
It does have to do with vaccine supply. We are amidst a historic moment. Right, having dealt with a pandemic of gargantuan proportions, it's led to, immeasurable tragedy. 500,000 people have died from COVID in the United States in the last year, which is hard to fathom and even harder to swallow. We are now, amidst a point where we are going to be trying to vaccinate as a country hundreds of millions of people, and as a globe, billions of people. But right now, dealing with a situation where there is only a few 100,000 vaccines getting out to states, on a weekly basis. So we have a long way to go to get to the point where we can achieve herd immunity through vaccination. And so what the Centers for Disease Control have done in the federal rollout in combination with the states is try to prioritize the limited amount of vaccine we have at the moment and concentrate and administer that vaccine to the people at highest risk and those that are involved in keeping our society going. I think it's all of our hopes, certainly is mine, that we could escalate this vaccine campaign much more rapidly, that we would have unlimited, safe and effective vaccine that we could get into everybody's arms as quickly as possible and as soon as yesterday. But right now, as we deal with limited supply collectively, we're asking all of us to wait our turn in line, so to speak, so that we can, protect the most vulnerable amongst us while we, move as quickly as possible to there being a point in phase 3 where it's accessible to everybody.
Well, Dr. Roos, thank you so much. Hopefully that answers some of our viewers' questions who tuned into this Facebook Live and commented asking about the state's rollout. And Dr. Roos, thank you so much for your time. Just like that, our special is over. And it's been great partnering up with you, Mercy Medical Center, and Trinity Health to answer our viewers' questions. Now, we hope all of you at home did find this informative and a reminder for all of the latest information on the COVID-19 vaccine. You can, of course, download our free Western Mass News streaming app. Dr. Roos, thank you so much.
It's my pleasure, and thank you for hosting these important educational events.
I think that was very informative, and to all of our viewers at home, thank you for chiming in and have a good night.